lives. And with me at this time is Dr. Kecia Lowe, specialist in pediatrics and internal medicine.
Morning.
Good morning, Doc. You
Morning.
look wonderful.
Thank you. I feel great.
Didn't go to the beach this morning?
Not this morning.
I couldn't go either. Right, Doc is always on the beach. He's a health freak, I would say. She and her husband is always on the beach and training and running. And it is so important, Doc, to get up early in the morning and exercise.
Yes, I agree.
Yeah.
It's very
How
important.
important is that?
It's very important to your health and wellness. And the thing is, what they found is that people who get up early and do it early before the rest of the day's obligations step in are 70% more likely to stick with their exercise routine than those who leave it till the end of the day. Because at the end of the day, things can happen. You're tired. Meetings get in the way. You just, more likely to skip your exercise when you do it in the evening.
You're a morning lady. I'm so in support of you. And in the morning time when you do that, you feel so different, Doc.
Oh, for sure. A lot more energy. A lot of energy. Patients don't believe me, but sometimes they come and they're just deconditioned. Their body is out of sync. They haven't been moving the body and exercising and so they come and they just don't feel well. And sometimes all you need to do is change your lifestyle choices. Do some exercise on a regular basis. Drink your water. Get your sleep. Manage your stress, and you can feel a lot better. And doesn't always have to be a pill.
You need to get that early move, that early drive. And
it's not easy. I will be the first one to tell you it is not an easy thing to get up out that
But
bed,
it gets easy when you get used to it, Doc.
I guess.
Yeah.
But like when it's rainy and cool, the easiest and the default is to just roll over and say, okay, I'll get an extra hour of sleep.
Yeah.
But
I'm not
we have to
boasting,
be
but
disciplined.
sometimes I know it rains and I say I'm not going nowhere. And then I'm up, I don't even know. The system has gotten so used to it.
Yes, it's really important.
Yes.
And so your body is like saying, hey, let's
go.
go.
You have to move.
Ready.
And when it says you're going, you can't fight it, eh?
That's right.
Right. And Doc, you've been involved for 15 years in pediatrics and internal medicine?
Mm-hmm. Well, actually, my office has been open for 15 years. I've been doing this for 20 years.
Right.
But in terms of my office in Calavini, the Brooks-Smith Lowe Institute, we opened on October 11th, 1999. So next month will be our 15th anniversary.
Brooks-Smith Lowe Institute.
Mm-hmm.
Explain.
Well, basically, it's a holistic health care center. I practice pediatrics, which is children's medicine or medical care of children, as well as internal medicine. A lot of people don't realize that internal medicine is adult medicine. So internal medicine is to adults what pediatrics is to children.
Right.
And so the name is not that descriptive, but basically it just means the health and wellness and care of adult diseases and adult health. So I did a combined specialty. So I specialize in both internal medicine and pediatrics. So I'm able to offer a kind of like a family health care.
Understand you do yoga too?
Oh yes, I'm a certified Purna yoga teacher. I've been doing that for I think 4 or 5 years. We opened our studio in 2011, and so my husband as well is a certified Kripalu teacher, and my daughter is a certified Vinyasa flow teacher. So there's three of us are in the studio. We teach yoga.
What's synonymous? Some of the traits of yoga.
Well, yoga is a practice. It's not a religion, as some people think. It's not that. It's a practice of breathing and moving in terms of postures and meditation and stretching, relaxation. And it really helps you to, get in touch with your body, listen to your body, listen to your heart. It's a lovely practice, and it helps to balance you out in terms of your stress levels, in terms of your spiritual, just getting yourself calm and quiet. A lot of us are so busy doing. We don't have time to be.
Yeah.
So yoga helps you to be, and also it helps to lengthen the muscles. A lot of what you see us doing in the mornings, the running and the gym and the swimming, it strengthens us, but it shortens the muscles. Whereas with yoga, you get strong, but it lengthens the muscles. So it helps to balance out your body. So you notice in many countries now, the NFL, all these highfalutin, these professional athletes have yoga training. That's part of their training.
They got yoga instructors.
Yeah, so they
Yeah.
have actually yoga instructors who are attached to teams to help them balance out, because these people who do all this American football and all kind of different things, they have to train.
You talk about strengthening the muscles and lengthening the muscles.
Lengthening them.
Oh,
So that is just a
give us a
complementary
little,
way.
give us a little, would I say,
So it's just a complementary way of strengthening your muscle, but instead of shortening the muscle fibers, they lengthen them. So it complements when you're doing all those other kind of exercises that we tend to
Okay,
do
we
in
do-
terms
we
of the
do-
running, the boxing I see you
Right,
doing in the
right,
morning and all
right,
that.
yeah.
It strengthens your muscles and tones them, but it doesn't lengthen them. So a lot of times you get stiff. There are these bodybuilders and they walk around like this. They can't even, they can't relax their muscles because
how-
they're so bulked up.
how can you lengthen the muscles? How can you?
By doing the stretching and yoga and doing the postures and breathing and holding the postures, and just to the point of awareness, not pain. So a lot of people, when I approach them and I say, look, why don't you come to a yoga class? We can offer you a free class, come and see how it is. And they say, but doc, I'm not a pretzel. And they have a misconception about yoga. Yoga is not just for these people who are pretzels and all that. Actually, the people who can't do it, the people who are stiff, actually benefit more from yoga, because they gradually lengthen the muscles and increase their flexibility slowly, not overnight.
Okay.
A lot of us have been sitting in chairs and running and doing things for years, and it's new for the body to start getting that flexibility. So flexibility is also important in remaining young and balance. So yoga is also big on balancing, practicing balance. And so a lot of, when you see kids, you see how kids are. They open up the joints, they are flexible, they have good balance. And when you see an old man or an old woman, they're stiff, they have no balance, and so we want to avoid this. We want to remain young.
But can that be
So
can
part
that be
of yoga-
avoided as you get older, doc?
Yes, that's what I'm saying. Yoga, if you start practicing it and do it
If
at
you're
home,
70 and you would get stiff, a bit stiff.
Not if
as you
you're-
get older, you start to feel the stiffness coming in.
But if you start practicing from now in your middle age, you start getting those muscles to be flexible and stuff. You do not have to be as stiff.
Ah,
One of the greatest yogis, Kecia Iyengar, just passed maybe last month or the month before. Time is flying so quickly. And he was one supple man. And a lot of yoga teachers and yoga instructors can be supple. It's how you train your body. Because you can get weak as you get older, but if you're doing what you're doing 3 days, 4 days a week, then you maintain your muscle strength. So
I
your
know
muscle
that.
mass. So the same way you can maintain your muscle flexibility and lengthen your muscles by doing some stretching. And for those people who don't want to necessarily do yoga, they can do stretching and breathing at home. That's fine.
right. Got
So
a
it
big
helps to
yoga
complement.
class?
Yes, we usually have about sometimes anywhere from 6 to 8 students. We have about maybe 8 classes a week.
Okay.
We have a website. You can go on and check our different classes. We have classes 5 days a week. The only days we don't have classes are Fridays and Sundays right now.
Right. Now, very interesting indeed.
Yes. But health and wellness is a real important topic for Grenada.
It is.
And if we have a healthy population, then we can move forward and be productive as a nation. And as you know, right now we're having an epidemic of the chikungunya virus, and that has been keeping a lot of us healthcare professionals on our toes, and it hasn't been an easy thing. And a lot of it is environmental in terms of maintaining your environment, getting rid of the water that's stagnant, getting rid of all the, things that are around where mosquitoes can breed, because this is transmitted by the Aedes aegypti mosquito, and so we need to really focus on that.
And how do you get to the people who think that there's something there besides the mosquitoes?
But
Many
the
people are
mosquitoes are
thinking
ubiquitous. The mosquitoes
that,
are
there is
everywhere.
something else.
Like what? I mean,
I
the
don't
fact
know,
is the
but
mosquitoes are everywhere. Everywhere you go, there's mosquitoes. It just takes one infected mosquito, and not even an infected. It takes an infected person or an infected mosquito to bite you and bite the person who's infected and bite someone who's not infected. It doesn't take a rocket scientist to figure that out.
But how does the body become immune to that?
Well, once you get
Or
infected,
can
your body.
can you be immune to that?
Well, once you're infected, as far as I know,
Maybe
you
if you're
cannot
like
be
you-
reinfected,
like you've been
but you can
saying.
have relapses within that same infection. But once your body has enough antibody, usually you don't get a new infection.
Okay.
But I understand that you can get relapses in terms of within the acute illness, you can feel better for a day or two, and then you may fall
And
down again in terms
it's kind
of
of
slight
frightening,
fever
Doc,
and
when
pain.
the
Very.
officials say that about 60% of the population is affected by this
Yeah.
thing.
But it's a common thing that, in terms of epidemics, it causes epidemics in many countries, and that's because of the environment, the tropics, the mosquitoes are everywhere, and we are not really focusing on environmental control as much as we should.
Right, Doc, what has it been like over the past 15 years dealing with the young kids as pediatrics and...
A pediatrician, yes, it's been wonderful. I really enjoy dealing with new babies and watching them grow up through their toddlerhood, through their childhood. I feel blessed because I do internal medicine. So when they turn 18, I don't have to give them their medical records and say, okay, you have to go see another doctor now. I don't only see you up to age 18.
Okay.
So I really handle from birth to death. And so I have a couple patients who are homebound patients that I actually do house calls for, patients who have family away, and when I see them, I have to email the children and say what's happening. So I really feel quite, fortunate that I chose this double specialty so that I could take care of families. I shouldn't really say families, Trevor. I should say basically women and children.
Right, yeah.
I see the men when things are real bad, but the majority is women and children.
Tell me about that.
The men don't come unless things bad. But I'm trying to change that.
What's bad?
It has to be fever, pain, penis, something critical that a man will come, or a nagging spouse or a partner.
Okay,
But most of the time, when women will come for their checkups, their pap smears, when men come and you tell them, look, you're over 40, you're a black male, you need to get a prostate exam,
Right.
they want to run in the opposite direction. There, a lot of males in general, I shouldn't generalize, but from my 15 years of experience, I have a few, and let me say, I do have a few male patients that do come routinely, at least once every year, every other year. But the majority of males that come are because they're sick and they need to be, treated.
So,
But pediatrics has been a wonderful, gratifying thing, and I think that I've tried to make, very good influence on parents and keeping their children healthy and monitoring their health and encouraging them with dental health and, preventive health care. I think that's what is important.
right, so where would we see Brooks-Smith Lowe Institute in the next 5 years?
Well, I hope you'll see us there, building from strength to strength, continuing to provide services, being available for emergencies and house calls as much as possible, but, we'll see what happens.
Yeah. Doc, thank you so much.
Thank you.
And keep
Have
up
a
the
great
good
day, and I
works,
look forward to seeing you again on the beach.
Look forward to see you too, and I know when I see you and your husband, well, you meet me all the time, so I'm early. No, but sometimes you're running,
Yes.
and I pass you
Well, we go to the
sometimes.
gym first, and
Yes.
then we do our running and stuff, so.
Yeah, but you cannot overemphasize how important it is, Doc, to
Well, listen, the message I'm
physically
giving
fit.
is to practice what I preach. So patients can't say, look, doc, tell me get up out my bed, and doc, there in she
Doc,
bed.
right,
Look
right.
at doctor, and my patients will say, doc, was that you I saw running, or was that you? So I feel good. I'm trying to set the example for my patients. So I hope that they take the cue and follow along.
Keep up the good work.
Yes, thanks, Trevor.
Right, speaking there to Dr. Kecia Lowe, specialist in pediatrics and internal medicine, and she has been around for some 15 years doing a wonderful job. Well done, Doc.
Thank you.
25 minutes gone past the hour. We're going to take a break and come right back. It's all happening right here on the GIS Spice Morning for September the 23rd.
I remember when this beach was really wide, a place to picnic and play cricket.
And we used to go up to the end to get away from all the people. Now all the beach gone.
Coastal erosion. When the sea starts to come in and take the land away, everyone loses something.
Granny, look how the waves are washing right under that house.
Coastal erosion. It's a hazard. Hazards. Take control. Reduce your loss. What can you do to help stop coastal erosion? For one, don't drive four-wheel vehicles on seaside dunes. They loosen sand and destroy binding vegetation, causing erosion. Find out more about coastal erosion and other hazards at your local disaster office. A message from your National Disaster Office and SEDERA.